Our health equity issue is that rural Panama faces massive challenges regarding access to healthcare for those living in rural areas. This is a self-perpetuating issue, as the areas receive less funding, less education, and therefore are unable to properly access quality healthcare compared to urban locations.
The causes of this problem include historical marginalization. These rural areas and indigenous regions have long since been suffering from lack of development and of infrastructure, general healthcare faculties, public services, and sanitation. Another cause is geographical isolation. These rural areas are often separated from urban areas, leading to not only issues with officials and workers having trouble coming to these rural areas for public services, but also residents having far reduced access to nice and quality healthcare in urban areas due to their distance from them. There's also economic disparities, which is the general lack of wealth in rural areas, leading to lower funding and access to healthcare.
The socioeconomic factors contributing to the issue include poverty, because the rural areas have more poverty if individuals' ability to afford healthcare services and associated costs are limited. Educational limitations are also involved, as lower education causes less knowledge and ability to both apply and participate in public healthcare services. Another cause is employment challenges, because due to the popularity of informal employment in rural areas, which leads to the lack of public healthcare, insurance, and job-related health benefits due to working under the table.
Panama can address this issue with infrastructure development by spending more money on constructing healthcare facilities and expanding access from urban areas to rural areas. We can guarantee rural towns are a decent proximity to a hospital or healthcare facility. They can also use mobile health units like health vans for far out emergencies in towns that aren't close enough to deploy clinic ambulances to reach them. They would provide essential medical services and health education inside. By utilizing telehealth technologies to connect rural patients with specialists in urban centers, they can mitigate the impact of geographical barriers. They can also train local community members to offer basic healthcare services and education, bridging gaps between healthcare providers and rural populations. Policy initiatives can also help by implementing government policies that allocate resources and incentives for healthcare professionals to practice in rural areas.
If you want to learn more about the health equity and healthcare challenges rural areas face, you can use resources including the World Bank report on initiatives taken by Panama on Health, Panama's own voluntary report on this, and Rural Health Info Hub, giving insight into rural disparities in the U.S. applicable to Panama. By exploring these resources, individuals can gain a deeper understanding of the challenges and potential solutions related to healthcare disparities in rural Panama.
And here are our sources for this health equity PSA.